My name is Rachel Jones, and I'll be doing a head-to-toe assessment today. This is my patient Aston Jones, and for demonstration purposes, he'll be an 18-year-old male. I know we only have 10 minutes, and I'm having a hard time fitting everything in, so I'm just going to go quickly, but in a normal exam, I would take my time. And I would come in, wash my hands, introduce myself to the patient, get a history of family history, and find out if there were any problems we need to address today. I would take note of his level of consciousness, his speech, his affect, his mood. I note that his nutritional state looks good and hygiene looks good. Okay, I'm going to start out asking if at any time you feel any tenderness or pain, please let me know, or if you feel uncomfortable and would like me to stop, let me know. I'm going to start by inspecting the scalp. The skull looks good, no protrusions, everything's symmetrical, no lice present, no lesions noted, hair is distributed evenly. Okay, I'm going to turn you around this way. I'm going to check for TMJ. As to any pain, when you open your mouth for me, close, no pain noted, good. Just palpate the artery there. Okay, and I'm noticing his facial features, his muscles, everything looks good, symmetrical. His eyes look symmetrical. Any tenderness? Okay, his sclera is white, conjunctiva is pink, lashes are intact. Okay, Aston, if you'll just look at me, I'm going to test his pupils. And they're equal and reactive to light. At this time, I would have him do a visual test with the Snellen chart, standing 20 feet away. Okay, I'm going to check his fields of gaze. I assume if you'll just follow this pin for me. Good. Okay, and his nose is symmetrical to his face. Any nosebleeds or runny nose, anything like that? Okay, and if you'll just tilt your head back a little bit and notice his mucosa is pink, no polyps noted, septum looks good and intact. No problems there, everything looks normal. His lips are symmetrical to his face, no cyanosis present. Ask if you'll open your mouth and say, "Ah." Okay, and everything looks good in there. Mucosa is pink and moist. There's no inflammation on the tonsils. The softened palate looked good. The uvula was present. Tongue moved fine. The teeth were white, clean. Gums looked good. Okay, I'm just going to have this way. I would inspect his ears. There's no lesions on the outside. I would pull up and back, inspect, make sure I could see the tympanic membrane and it's visible with no lesions on it, no tears. I would inspect the other ear. Tympanic membrane is visible. Okay, at this time the Ryan's test could be performed, and you would use the tuning fork right here behind the ear. Also could be the Weber's test. Okay, and I'm going to start on the lymph nodes. You'll just tilt your head back a little bit. Any tenderness? Okay, and they're non-palpable, no masses noted. Okay. Okay, and I'm going to inspect the trachea, and it is not enlarged. Turn you this way. Inspect the thyroid if you'll swallow. Again. Okay, good. Okay, I'm going to inspect the carotid artery. I'm noting there's no jugular vein distension present. And I would listen to each side of the carotid artery with the bell. Take a deep breath and hold. Notice that there's no roots, and I would do that to the other side also. Okay, I'm going to start with the posterior thoracic area. So let me get you to just turn this way with your back facing me. Yep, in the chest. No, just
I don't know
face that way. There you go. Perfect, perfect. And the chest looks good, symmetrical. Everything is even. I don't notice any masses or nodules. Aston, tell me if you feel any pain. Okay. And I'm going to check for tactile fremitus. If you'll just say 99.
99.
Again.
99.
Again.
99.
And thoracic expansion. If you'll sit straight for me. Take a deep breath. Blow out. Good. Okay. And I'm going to do percussion. And again, I'm just going quickly because I'm trying to get in that 10-minute hole. Okay. Good. And now I'm going to auscultate. And I'd have Aston put his cross your arms for me and breathe a little bit deeper than normal. And I would listen for a full inhale and exhale in each spot. But for demonstration purposes, I'm just going to briefly walk it through. Okay, good, Aston. Okay. Now I'd have him turn to the front. Okay, you can put your arms down. And I would just repeat the same routine to the front. Everything looks good. Okay. Any tenderness or pain? Okay. 99.
99.
Again.
99.
Again.
99.
Deep breath and let up. Good. Again, I'm just going very quickly and getting that. Okay. And I would auscultate. I would be listening to a total inhale and exhale in each spot. Okay. Okay, now I'm going to listen to the heart, and we're going to do it sitting and lying down. Again, I'm just going to quickly go in the 5 spots here. Okay. Now, so I'm going to get you to lie down for me. Okay. And we palpate the area. And notice no masses, no pulses, no heaves. And I'm feeling the PMI. I'm also going to listen to the bell and have him roll. To your side. And back over. Good. Okay, now I'm going to lift your shirt and just check your abdomen. Color looks uniform. Umbilical is midline. Everything looks good there. I'm going to listen to the bowel sounds. Quickly. Of course, I would take time. And they're active and present times 4 quads. Now I'm going to listen to the vascular sounds. Start midline, aortic site, to the arteries here and here. Back up. Good. No brutes noted, no venous hum noted. I'm just going to percuss. Okay, good. Okay, I'm going to do light palpation. Any tenderness or pain here? Here. Here. Okay. I'll palpate. Deep breath. Blow out. Okay, I'm going to do the spleen. Deep breath. Blow out. There you go. Percuss the spleen. Okay. And I'm going to do a couple of tests. I'm going to check for revert pain. Aston, let me know if it hurts when I touch here or anywhere else. Here. Okay, what about here? Okay. And I'm going to do rebound tenderness. Check for rebound tenderness and let me know if it hurts when I touch or when I let go. Any pain? Okay, what about this side? Pain? Okay, good. Okay, and I'm going to have you lift your leg for me. Any pain in your abdomen? Okay. I'm going to do a heel test. Any pain in your abdomen? Good. Okay, and I'm going to do the Murphy's test. Deep breath and blow out. Okay, and at this time I would check all his pulses, the femoral pulse, the popliteal, and the dorsal pedis, dorsalis pedis. And I've noticed that there's no clubbing in his fingers, the capillary beds look good, and capillary refill is good. Okay, Aston, if you'll stand up for me, I'm just going to check your range of motion real quickly. Okay, if you'll just turn your head to the side this way, forward, side, touch your chin to your chest, good. Okay, and if you'll just face the wall and bend over, touch your toes, I'll check for scoliosis. Everything looks good there, okay. And at this time, too, I could do the Romberg's test, which I would have him just stand facing like this, hands by your side for 20 seconds. And then I'd have him close his eyes and check another 20 seconds. And that concludes the head-to-toe assessment. Thank you.